think you guys have done a wonderful job of getting to the bottom of some of the root problems and talking about context specific in different countries, different regions, and people groups. Some of the major health concerns are just health availability or childhood malnutrition are huge issues, and I really like that it's been stressed of the systems approach. Just like human health is such a systems approach, so one thing affects a million things in the body. But I'd like to know, from your guys' experience, what are some ways that you can do that? Breaking down silos is a buzzword, but how do you do it? And what does it look like in a real sense in a different context?
Do you want to? Okay. And then there's somebody in the back. Oh, somebody in the back. Yeah.
This is very related to, I'm sorry, my name is Charlotte Dufour. I work in the FAO Nutrition Division. One of the things I wanted to raise is I feel there's tension in the discourse in this conference between we need a systems approach and what is the one intervention you would ask the Minister of Finance to fund? And I think that, and I don't have numbers to quote because I've been putting off doing a PhD for 10 years, but I have the stories from Afghanistan.
It's not a prerequisite, by the way.
Yeah. But, you know, there was very interesting community development and women's empowerment programs run by NGOs. And some of the story women would tell us is, since I've become literate, I know which room to go to in the health clinic, or I can read the prescription, or I can check I'm paying the right price for the food in the market. Since I've earned income, I'm more respected in my household, and I can actually tell my mother-in-law that I want to exclusively breastfeed my child. Nutrition education in schools. I was fascinated when we did the monitoring. What did you guys learn? And adolescent boys telling us, we learned that exclusive breastfeeding is very important for children. So we keep on, you know, breaking these things down. And I think maybe we should question the way we've been doing research, in the sense that we're looking for the interventions. And so often we look at a set of interventions and a limited set of outcomes. Maybe this agenda on resilience is an opportunity to start looking at delivery systems and how can we use delivery systems effectively for multiple interventions and multiple impacts. And just a practical example again from Afghanistan, we were training women who were training women on poultry raising and dairy keeping on nutrition. And some of the women they were training were said, that's good because finally, we've been, learning how to take care of chickens for 3 months. It's about time we were helped to take care of our children. And it was a very limited cost, because the high cost was getting these women out to the villages. But if they're equipped with a number of key messages, they pass it on. And how can we pass on? A lot of it is how can we pass on information in communities, and then it circulates. So just a few.
You got a mic?
Yes, I got a microphone here. So my name is Benoit Yonfin. I work for Partnership for Aflatoxin Control in Africa, based at African Union. I want to approach health from different perspectives. And then when we are talking about food and nutrition and then health, I think there's something we are missing. And I thought we could go back to that concept, which is our traditional medicine. And I think that is another group, our traditional pharmacopoeia, we should involve them at some point in this forum, for instance. Because we have a lot of plants which, because of the development today, has been destroyed. But those plants, they have a lot of antioxidant compound, microbial compound, and these are very useful in the treatment or the prevention of a disease when we are talking about health. And then those ones have been used in the past as a food, as a supplement, as a food as well. So I think we must involve those categories because those stakeholders as well, when we are talking about health, food, and nutrition security. So that's what I wanted to bring so that we could think about it.
can I just check something with the room, because I need to do some summing up, and I don't want to completely do a discussion. And it was bothering me last night, because we were hearing all about multi-partner, multi-sector, it just seemed awesome. So thinking about, what are some of these levers that have multiple benefits? And I think basically, Charlotte, you're talking about capability. And we've had lots about empowerment, enabling, really kind of equity issues and things like that are central to this kind of really making things happen at multiple levels, and how important it is for health and the inclusiveness you talked about earlier in terms of mental health. Is that something we see as a critical kind of thing? I mean, obviously health and nutrition are central to human capability anyway, right? That's part of it. But is that a key kind of entry point that we see that's important? Or am I just making things up?
I think you're probably right.
Lawrence, do you want to comment?
John, I think that's right, except that takes investment.
Yeah.
And that means incentives. And what are the incentives for the Ministry of Finance, who's worried about short-term issues and is worried about an intervention leads to an outcome? So it's really, I really agree with what Charlotte was saying. And I think the research community and the evaluation community needs to do a much better job of capturing multiple benefits across. So if you're equipping a community health worker to adapt and prevent and absorb and transform all these things around her, manage uncertainty, you've got to invest in that.
Yeah.
What's the benefit to doing that? Well, you've got to actually capture that across a whole range of things,
Yeah.
not just health. It's women's empowerment, it's education,
So-
and then you've got to capture it in the long run as well.
Yeah.
So we're not doing a very good job of making the case
I've
to the
got a
Ministry of
feeling
Finance.
you missed it last night and the ministers this morning, but I think we're doing better than you think. They were really talking, they talked about economic growth, but they talked about human capability in quite profound ways, I think, didn't they? And yes, that's right. But it was on their radar screen in a way that you wouldn't have heard years ago, and that's a big start.
I just want to add a word to capability. For me, that's information.
Yes, knowledge.
Yeah, it's about making choices. That's what I'm saying.
Okay.
So
Can you take the mic?
But nobody can hear it, or at least it won't be referred.
my point was capability, and enabling people to make the choices requires information, so that they're informed about the costs and benefits of different tracks of decisions and where that might take them. And I totally agree with Charlotte, and I think looking at those systems as platforms for delivering multiple services and multiple outcomes is critical, but that needs really careful prioritization of indicators and of information flows. And this comes back to a point that was made earlier about the power of youth and using them as a nexus for actually distributing messages across.
This also links up with Harold's point, which was we can't foresee and prevent everything. So we need the resilience which comes from people being innovative and knowing things and being able to adapt, basically. And sometimes when those capabilities are really low and things are changing fast, people can't adapt and we have real problems. So I think there's some threads there. I don't know how well I can summarize this, but we have to stop. But the panel members are, I'm sure, quite happy to talk to you on specific issues because they're a rich source of information. We have said that kind of knowledgeable people can be useful in this process. And thanks very much for your interest and your passion in this. Has been great. Thank you.